Did you know that millions of people around the world are walking around with weaker bones and don't even realize it? Osteoporosis is often called the silent disease because you might not notice it until a fracture happens. In this video, we'll break down everything you need to know, from causes and symptoms to diagnosis and treatment, so you can protect your bones and live stronger. Welcome to my channel, your trusted source for health and wellness tips. Today we're talking about osteoporosis, a bone disease that affects millions globally. Whether you're young or old, this is information that could help you or someone you love. Osteoporosis is incredibly common, especially among older adults. According to the International Osteoporosis Foundation, it affects over 200 million people worldwide. Women over 50 have about a 1 in 3 chance of experiencing an osteoporosis-related fracture, while men have about a 1 in 5 chance. And here's the thing, it's not just an old age disease. Poor lifestyle habits, certain medical conditions, and even genetics can put younger people at risk too. So, what causes osteoporosis? At its core, it's when your bones lose density and strength faster than your body can rebuild them. This can happen due to several factors. Aging, natural bone loss increases as we get older. Hormonal changes, especially the drop in estrogen during menopause and low testosterone in men. Poor nutrition, lack of calcium and vitamin D. Sedentary lifestyle, not enough weight-bearing exercise. Medical conditions and medications. Certain illnesses and long-term steroid use can increase risk. Smoking and alcohol, both speed up bone loss. Osteoporosis is tricky because it's often symptomless in the early stages. However, as bone density decreases, you might notice things like back pain from fractured vertebrae, loss of height over time, a stooped or hunched posture, or even bones that break more easily than you'd expect. By the time these signs appear, bone loss is usually advanced, which is why early detection is so important. Doctors usually diagnose osteoporosis with a bone mineral density test, commonly called a DEXA scan. This painless scan measures the strength and density of your bones and helps predict your fracture risk. Blood tests may also be done to rule out other causes of bone loss. While osteoporosis can't always be completely reversed, there are many ways to slow bone loss and prevent fractures. First, medications like bisphosphonates, hormone therapy, and some newer bone-building drugs can really help. Next, nutrition is key. Eating foods rich in calcium, like dairy, leafy greens, and almonds, as well as vitamin D from sources like fatty fish, eggs, or supplements, is super important. Exercise also plays a big role. Weight-bearing activities like walking, jogging, or resistance training help strengthen both bones and muscles. Making some lifestyle changes, such as quitting smoking, limiting alcohol, and preventing falls in your home environment, can make a big difference. And finally, regular checkups are essential for monitoring your bone health over time and adjusting your plan as needed. Osteoporosis may be silent, but it doesn't have to be invisible. By knowing your risk factors, making healthy lifestyle choices, and getting regular checkups, you can protect your bones for life. If you found this video helpful, hit the like button, share it with someone who needs to hear this, and subscribe for more health tips every week. Stay strong, and I'll see you in the next